In today's presentation, we are going to cover your LPS benefits options along with the changes for the upcoming 2026 plan year. Let's get started. The first thing you may notice is the blinking message asking you to have your phone at the ready. Throughout the presentation, you will have the opportunity to scan QR codes. LPS offers employee paid benefits if enrolled for medical, dental, vision, employee life, and disability plans. Employees also have the opportunity to enroll in voluntary insurances for themselves and their dependents. We're not going to go into details about those today, so we encourage you to view the benefits guide for more information. A quick note before we dive into our key updates. Remember to file your wellness claim if you were enrolled in the critical illness, accident, or hospital indemnity plans. Each plan offers a $50 annual benefit for each covered member. Scan the QR code for claims filing instructions, or, new for this year, you can file your wellness claim by simply calling the standard. We also want to remind you that LPS offers an employee assistance program that allows up to 4 visits per issue per year. Contact our wellness coordinator, Rebecca Fisher, for more information. Key updates for 2026 include lower premium for voluntary insurances, minor dental plan changes, and of course, our biggest change that we will discuss last in our presentation is our health plan network change from Blue Cross Blue Shield of Kansas City to Cigna. With this change, we will discuss changes to prescriptions, deductibles, premiums, ID cards, and SpireCare. If you scan the QR code on the screen right now, it will take you to the LPS staff portal for open enrollment, where you will find all of the details that we will discuss today. The hospital indemnity, critical illness, and accident plans all have a premium decrease starting January 1st, 2026. As a reminder, if you plan to expand your family for the new year, consider enrolling in the hospital indemnity plan. Our dental plan remains with Sun Life and has no premium changes. However, there are a few changes to the plan design. As you can see, the deductibles for each of the plans have increased. The buy-up plan previously had a zero deductible for both individual and family. The new deductible for individual is $25 and for a family it's $50. The base plan now has a $50 individual deductible and a family deductible of $100. Preventive and basic services have not changed, but the major services that were previously paid at 80% are now paid at 50. While that seems like a big change, it is important to remember that the annual maximum has not changed. This means that the base plan will still pay up to $1,000 per calendar year, and the buy-up plan pays up to $1,500 per calendar year. Sun Life also has a preventive rewards program that allows you to earn reward dollars up to $300 per year, with a maximum of $1,000 for the base plan and $1,250 for the buy-up plan. Contact Sun Life for more information. Okay, folks, let's talk about that medical. You will see the Blue Cross Blue Shield name in blue and the new Cigna plan name in green. Notice the plan names are similarly named with their deductibles. Employees who were previously enrolled in the zero deductible plan are now able to continue their current enrollment, but any new enrollments into this plan are not allowed. If you are enrolled in the employee only option for any of the plans, you will notice a premium decrease. Just a reminder, the premiums you see on the screen are monthly. Scan the QR code to view premiums for employees who pay their premiums over 18 or 24 payrolls per year. Prescription benefits are part of the Cigna medical plan through Express Scripts. You will see each of the prescription options have a copay increase. For example, if you are paying $20 at your pharmacy, you will now pay $25. You may want to consider filling your prescriptions before the end of the year to avoid this copay increase right away. Some medications require a prior authorization from your healthcare provider. LPS is working with Blue Cross Blue Shield to transfer those to Cigna. However, we want you to be prepared that you may need to be able to obtain a new authorization from your healthcare provider. Specialty medications that were previously filled by Optum will now be filled by Express Scripts Specialty Pharmacy Accredo. If you currently take a specialty medication, you can expect to be contacted by Accredo to assist you with this transition. Employees who take maintenance medications have a new option to fill a 90-day prescription at a CVS pharmacy instead of mail order. Walgreens is not automatically part of the 90-day maintenance program, but employees can request Walgreens to be added. You will need to contact the phone number on your ID card. Employees are also encouraged to look up their medications to ensure they are still on the approved drug list. If you find that your medication is no longer covered, you will need to work with your healthcare provider to find an alternative option. When reviewing the drug list, make sure you select the Value 3 tier. First, let's discuss the name change from SpiraCare to the $2,550 deductible plan. SpiraCare was part of the Blue Cross Blue Shield system and will no longer be an option as of January 1st, 2026. You will need to find a new in-network provider by logging into the Cigna website or calling their customer service for assistance. Each of the EPO plans have had a deductible increase of $250, and the high deductible health plan has an increase of $300. The district was able to maintain the employer contribution of $1,200 per year for employees in the high deductible health plan. Your new health insurance network is through Cigna Local Plus. As you can see, there are over 7,200 providers and 63 hospital and urgent care facilities in our network. A quick view of the in-network hospitals. And before anyone asks, no, St. Luke's is not part of the in-network hospitals. Employees will be able to search the provider network by registering on mycigna.com. You can search by the doctor's name and type, or location using zip code or city name. If you do not find your provider under the expected zip code, try searching by the city instead. Did you know that virtual care is now free? Cigna partners with MD Live, and employees can utilize this benefit via phone or video call. The benefits decision-making tool known as Alex is being replaced by the Cigna option called Cigna Easy Choice Tool. This tool will walk you through a few questions and advise which plan may suit you and your family needs the best. More information to come on that. Why is registering on Cigna's website so important? Cigna uses digital ID cards and does not mail cards automatically to your home. Cards can be downloaded to your phone's wallet or saved to your phone. You will also be able to send your ID cards to your healthcare provider via email. We understand this is quite a change, and we're here to help. Registration opens December 15th. A copy of today's presentation will be available within a few days on the LPS staff portal. Remember, all benefited employees are required to complete open enrollment, as benefits do not automatically roll into the new year. Please review the emails and the benefits guide for open enrollment options and information. Of course, you can always call us, But with the busy season, we do encourage you to email us with any questions to benefits@lps53.org. Open enrollment will run from Monday, October 27th through Wednesday, November 5th. Employees attending today's presentation have early access to the open enrollment portal by scanning the QR code. Thank you, and let us know if you have any questions.